Thank you, Minister Sisulu. I'm now going to ask Minister of Health, Zweli Mkhize, to come and give his tribute. I think more as a friend than as the Minister of Health, but whichever you choose. Thank you.
A sonnet to fallen soldiers. Fallen warriors gone too soon. The best, the brave, the bold, and the bright. Like a comet thrust from the skies on a late summertime night, men who'd taken up the cause, giving no less than their all. 31 brilliant, eager minds for whom we silently pause. On behalf of the motherland, they've paid the ultimate price. We acknowledge now their families in memories of their sacrifice, and of their story time will tell, for they shall be remembered well. This Nancy, the family, Mazangwa onke, izihlobo bakwaMandaza nazo zonke izihlobo, my colleagues, Minister Zweli for Home Affairs, Minister Sisulu, former Deputy President Phumzile, and mfowethu Relani Ngcuka, izihlobo zonke, baba mfundisi, siyazithoba phambi kwakho phathi wohlelo, sibonge ithuba. Usuku olunzima, usuku olubuhlungu, kodwa sibonga ukuba sibe ingxenye yalabo abambalwa abakwazi ukuphumelela. Isimo esiphila kuso sinzima, uthando lwethu silikhombisa ngokuthi singasondelani, kodwa namhlanje masivume ukuthi kusiqondile okubuhlungu. Thank you for your kind words, wethu Bulelani. We have the misfortune with you to meet, to have to talk about our close friends from a history of having been somewhere. And I always remember, I didn't know you were going to be here. I heard, and I always remember because the other time we were touched, we were going to go and pay tribute to Babu Griffiths, Kang, our Kulisa, who was our leader. And we met again. And today we meet again. Thank you for your very kind words. Makes a lot of difference. Thank you. Sizophelezela uBhiza. I'm just tempted on a lighter note. uBhiza wenze into enkulu. For the first time, I've seen the shortest speech from Minister Zweli. We timed him. We are with him every time he speaks. And I've been with him for the past 40 years almost. He never delivered such a short speech. He's always very pictorial as he was today. But thank you for your tribute. Mrs. Lindy, thank you for your tribute as well. I've been comforted by all those who have been here because they actually talk about the Bhiza we know. And I haven't got an option, my sister. I didn't come here as a minister. I came to a friend, a comrade. I met Bhiza way back around 1988. We were young doctors working in Zimbabwe. He worked in Pararenyatwa and my wife worked in Pararinyatwa and Harare Hospital. I worked in Harare Hospital. Were this young group of ANC young doctors, or Dr. Zindo Hashe, or Dr. Abel Maminze, or Dr. Mfenyana, and a whole lot of others at the time. And with our tasks there, almost divided 3 ways. During the day were normal doctors who worked in the hospitals, like all the doctors did. But then we had also another special responsibility of running an ANC hospital inside Zimbabwe, inside Harare. And this is where all those soldiers who came from the different parts of the countries inside SADC, they would be referred to that hospital and then would look after them. And it was from there that there would be decisions taken as to whether they must go for treatment in London, in Australia, or even in Soviet Union at the time. So we would come together, then discuss, look at what we have to do, and then wait for the order from the leadership as to where the arrangements have been made, and then we'd set together the records and send them there. Dr. Mramba Ming also was one of those. And a few of them had to be referred to Australia because of the apartheid situation. A certain level of sophistry in the medical interventions needed would have actually required that they need to move somewhere else and then would have to sit there and kind of work together in that situation. And obviously in between, we spent a lot of time talking about where the country was going and where we thought, where we thought things should be going and so on. Pisa impressed me in many ways. To start off with, let's say I'm not surprised you actually ultimately fell for the man. He was handsome. He was actually handsome in a way that I never realized. I always thought he was so many years younger than me because he was, good looking. But I agree with this Lindy. He was always very dignified and formal. And he gave you the picture when you say, when you saw him, you saw a doctor. And typically very confident, very friendly, and strike you as such, and kind. A man who was a real patriot. He loved our country, he loved our people, and he had proven it, beyond doubt, by going all the way out to the most extreme of what a lot of our young people had to go to. Going to exile and going to undertake military training to the extent that he did. He was a true revolutionary who believed in change for the better, and change in the interest of all our people. And he never changed from those principles. And so he moved away to Australia, came back. Then when we came back, and one of the issues, I'm sure the former Deputy President will recall this because they were, at the time, this was one issue which was a problem. We came back during the time when there was a problem on HIV and AIDS. And there was a crisis of confidence in the regime. And we all knew that any message that came from that regime was not going to be listened to by anybody. So we created what was called the whole National AIDS Council of South Africa, which was really led by us from outside the government. And then we created a number of chapters, and in one of those chapters, Biza was amongst those who were in the leadership. Again, very consistent and very passionate about what we had to do to make sure that we can deal with this kind of challenge that was facing our country. And he continued to work like that. And I must say that he was the kind of person who not only was he an inspiration when you discussed with him, but he was a kind of a beacon. So when there are issues under discussion, and you wanted to know if you are right, you wanted to first check where is Pisa standing. Then you know, okay, I can say right, Pisa utu right. That's a man who believed in really the goodness of our nation and the positive future, bright future that our country had ahead of it. And over the period, he continued to work and served as a doctor. One of the issues that we had to deal with was to take over the Medical Association. If there was anything that as young doctors we had a problem with, was the Medical Association that was collaborating with the government at the time. If you recall all the issues, particularly the tragedy of the death of Steve Biko, and so on, our issue was, where were you as doctors? Because you should be leading by integrity. And so the first thing we wanted to do when we came back was to change the Medical Association. And therefore we were to then have a group of young doctors who were prepared to go in there, take over and fight to change the direction, because we were not going to be represented by a body that looks very much like it was created to serve apartheid. And it's along the line, he was amongst those who became a leader amongst the new, transformed South African Medical Association. And we used to really spend lots of time to talk about what changes had to be done at that point. And so he continued the struggle for transformation at that level. Later on, I was then made chairperson of the Health and Education Subcommittee, and Sislindi was the chair of the Social Transformation Committee. But actually we shared the man, because when we needed to sit down and call a huge meeting where we needed to actually reorientate the whole approach towards national health insurance way back in 2009, Pisa was amongst the people that to sit down and call and say, we need to actually put a proper direction on this national health insurance. He was passionate about it. He was not going to be moved. It was very clear that he's going to be there. And so when we put this whole meeting together, he was amongst those that we knew, if you had so and so in this meeting, you knew that the direction was going to be a successful conclusion of that meeting. And there was Pisa. And he was very respectful all the time. A man of integrity, a man who never changed his beliefs about our country. And somewhere during the course of that process, he then moved to do a few other different appointments. And as time was going on, because of his deep conviction about how we need to transform the service, he actually was appointed to go and assist Comrade Gwen Ramakhupa, who was MEC for health in Gauteng. And I think we all recall that there was a crisis of how things were kind of slipped in the Gauteng government. And in the process, Comrade Gwen asked him to come and give him guidance and support. And what did he focus on? He focused on the issue of the quality of the health services. If there's anything that should ever be achieved to show, to demonstrate the dignity of our people, is the quality of health. From the cleanliness of the floors to the cleanliness of the linen and the quality of food, the quality of the buildings, the quality of the care that our people receive. and the humaneness in the attitude of our staff. That is what will make our people understand what the fight against apartheid, the first fight for democracy, and for their dignity, what it all means. So as I was appointed as minister, he then comes to me and he says to me, you know what, I've left that portfolio, but you know, this is my passion. As soon as you got time, let's sit down and talk about it. But doesn't matter what I'm doing. When it comes to the issue of quality of care, you call me, because as long as we have not achieved it, I will not rest. And that's the kind of man that we're talking about. And somewhere along the line, of course, we had to meet to discuss when he was working under the appointment as a leader of the Council for Medical Schemes. So we sit and talk about it. We went through the whole discussion about there is no way we can ever allow medical schemes to create a sense of discrimination amongst the doctors and create an impression that there are those that will be favored. And that's why, out of conviction, he took this whole assignment forward. And in the process, we're busy discussing this whole issue. Then I said to him, but the Council for Medical Scheme, ngiyayizwa kona. Uthini nge-NHI yethu? But ngihlalele kona la. In the first instance, you need to go sit down and ask yourself, why does government have 15 medical schemes, all with different packages, all being subsidized by the same government, serving civil servants, and each one of them is different? Is there sense in that? And I sat down and looked at him. I said, of course you're making sense. And then he said, no, as soon as you are ready, let's sit down and discuss. Because the NHI has to come, but by the time it comes, this aspect of the government medical scheme must have been transformed. Now, of course, a lot of things have been happening, but that was one of our major tasks that we were waiting to take forward with them. We set up a meeting, and he called and said, wait, let me finish the work I'm doing on this thing. I'm not done yet. When I come back, I want to give you a clear presentation as to what my ideas are. Because we spoke and then we challenged them to say, okay, then come with a proposal. Let's hear how the first transformation has to come about. And that was not to be, because now we're dealing with a very different situation. So on one of the days, I sit there and I'm very late. I sleep very late, and I check. There's a message that come through. Hey, and for some reason, his name is written in capital letters, so it's very easy to pick up. Oh, there's a message from Pisa. I check. No. This is Nancy. I'm sorry. I got your number from a dog's phone. He's not well. It was around 12:30 at night. I couldn't believe, so I called back. And I was just checking just I couldn't even check when the message come through. You have thanked Nancy as a family. I think we who are privileged to call Pisa our comrade and a friend, we have to turn around and say, Nancy, thank you. Throughout the time when Pisa was not well, you were the one who was giving me the update. I would call, you would send a message, but the love and the care you have demonstrated for Pisa, I can't say that it's expected, but I must say that it has been touching to us. And you and the kids have stood there and gave Biza the support. A number of doctors, they came up as soon as they had, no, there's a problem, Clarence is not well. A number of them came up and said, no, how can we help? How can we help? And some of them, I spoke to them as I was coming here, they conveyed their condolences. I won't mention names now, but you know, there's been a whole group of doctors who got around and were always trying to see how they can support in the process. But as doctors also, we know, when someone is not well, there's a set of interventions that you would go through. And you know there's a line. Once all of that has been done, if it was going to make the impact, it does. If it doesn't make the impact, we have to accept that that time has come. And in this case, it came to someone that we all feel, why should it be him? And certainly, the very painful story of this infection it's really changed the country, it's changed the world. But I think what Biza's message again is, we need to take it seriously. We need to accept that any one of us can get it and will get it. And we need to accept that. And that the whole world is going through a difficult challenge. It's really changed. I mean, when I sit here, the first week of March, before we got our first patient, I had to deal with a huge panic. 3 people landed from China. They were Chinese citizens. They got out of Cape Town, they were wearing masks. The whole of the Twitter world went abuzz. COVID-19 is in South Africa. We saw people wearing masks, 3 of them. If you had to get back fast track to today, you get surprised if somebody is not wearing a mask. That's how the impact of this infection has been. And I want to say to you, and Nancy and the family, particularly the children, be strong. After all, this is the necessary conclusion of life. There is no other way. It's just that when it happens, it will always be sad and painful. But when it happens, we must know that is the proof that we are all living when we die. It's not a contradiction. It's how the logical end of life is reflected in death. So we want you to be strong. As for the children, I think this is just a passing moment. You will forever carry the image of your dad with you. The dignity that exuded in his personality, the confidence, the brilliance, the professionalism is something that we who lived with him will always remember about him. And we're saying we must always be proud that you were fortunate to carry his name as your dad. We'll all leave, but there's nothing as good as having someone passing from this world and all those who worked with him agree that he was a good man. And that for me is a major source of your comfort. Diseases will come. That's not the important part. What is important is how do we remember him? And our memories of him are amongst the best memories. Always smart, but also very kind. And I think we need to we do need to send a message to all people in this country, South Africa. We need to be working together. We need to be united. We need to be strong to face this pandemic. We're not going to be different to any other country. We are going to be like all the other countries, The only difference we can make is when we work together to try and change the course of how, because of our unity, we were able to reduce the impact in terms of ill health and deaths. Now, of course, I think that the work that's been done by the President is outstanding. He's been a leader who led from the front, and he's been a leader who's been very consultative. He will phone, he will ask. I recall the first time I had to call him and say, Mr. President, I'm sorry, I'm going to give you a call that I know you don't want to hear about. We have the first patient. At the same time, we had to also say the same when we're the first patient who passed. But he's always ready to listen, and he wants to know the scientific basis of this issue. Now, when there are people who are concerned whether the science behind the decisions taken, there can only be one thing, there cannot be science about it. Because we work with a whole group of medical experts who have got various views, but at the end of the day, we remain confident that the approaches that we've taken are the best. We also know there's a lot that is unknown about the disease that we might actually teach the world about, or will learn from the world about. And therefore, because of all of that, I think we just need to work together, unite, and be strong. If there's any message that the passing of Dr. Clarence Mini, it should be that the people of South Africa must work together, must unite, and must try and hold each other's hands until we see this outbreak through. Farewell, comrade. Farewell, brother. And for us, it's a privilege to be saying farewell and sending you to all our heroes. You have also been a hero of our struggle, a revolutionary, a patriot, and on top of all, you are a people's doctor, a product of South Africa's struggle for a better health, for a national health insurance, for the dignity of all our people. Siduhambe kahle nzangwa. Siyobonana kwelizayo. Siyabonga.